What are common misconceptions about ER doctors
My colleagues in the ER, I work, we
or
work very,
trauma doctors? Because are those?
oh, they're separate.
Yes.
I'm glad you said that.
Yeah.
Yeah, they're separate. So we're not emergency medicine doctors. ER doctors are emergency medicine, which they're like our teammate, essentially. But they are truly like the jack of all trades because they have to treat the pneumonias, the COPD exacerbations, the diabetes. They still see all that in the emergency room, and they have to be our partners when we have injured or surgically ill patients come in.
Who's better? Who do we like
Oh,
better?
trauma surgeons.
Okay,
Of course.
definitely.
Yeah.
So, who's more likely to say if there's a group of ER doctors on a flight and a group of trauma doctors, and a flight attendant or a captain comes on and says, "Hey, is there a doctor on board?" Who is most likely to jump up?
The ER doctor.
Yeah.
Totally. Totally the ER doctor.
Yeah. Sorry, I cut you. But what are some of those common misconceptions?
That we're a little bit arrogant, which, my response to that is because it's not untrue, but you have to understand why. It's not, it's internally derived arrogance. It's not because people are out there stroking our egos. That's certainly not happening most of the time. We're not I joke about when doctors during the holidays get gifts from their patients. You go into the surgical oncologist office who's been treating cancer patients all year, and there's like baskets and chocolates, and then you go to the trauma office. There's nothing. There's nothing. But the arrogance comes from within because you think of what we have to do. I mean, we have these people that don't get a choice. They show up in our emergency room and they're putting their entire life in our hands. So it's just the sheer magnitude of the expectation that requires us to be a little bit confident in what we do. So there is a little bit of an air of arrogance about trauma surgeons in general, but I think they're misperceived sometimes that it's really internally driven. We're not all jerks.
I'd want a trauma doctor to be confident